Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and a common question that I get is about treatment timing for interceptive or phase 1 treatment. And if you ask an orthodontist, you're probably going to get 10 million different answers on this. This is just my opinion and what works for me and what I've seen that I think works well for families. But for the most part, it depends on what you're trying to do, right? So obviously, if this is a situation where you're gonna thinking about doing a 2x4 or a few braces on the front teeth, or you're trying to do some expansion with either a Schwartz or an RPE, or some phase 1 aligners, then I probably would wait until your sixes come in. Sixes are your 6-year-old molars, aka sixes, and in American speak, it's 3, 14, 19, and 30 until they fully come in, not partly come in. As well as I like to wait until 2 to 2 are also pretty much in or fully in. So 2 to 2 anterior would be, in American speak, 7 through 10 and 23 through 26. So the other thing that I keep in mind, is obviously, there's a few one-offs there, but the emotional maturity of the child. And I can tell a lot by how they are at the appointments, how they feel about this, just seeing if they're psyched up about maybe getting an expander or a retainer, getting some braces, getting some aligners. Girls emotionally are usually ready by about 8, 8.5. Boys are usually a little more, about 9, 9.5. And we're less urgent with boys than with girls because, we've got a couple different clocks that are ticking, right? We have our chronological clock, how old the patient is. We have our dental age clock, which, a patient, an 8-year-old could have teeth like an 8-year-old. They could have teeth like a 6-year-old. They could have teeth like a 12-year-old, We got that clock. And we also have our skeletal maturity clock. So girls can go through puberty at age 8. They could start at age 7. Could be 9, could be 10, could be 11. Average is probably around 10 or 11 for girls. But there's plenty that are 8 or 7. So you can't always tell just by looking at them. So it's a great conversation to gently have with the parent and patient. Just talking about treatment timing, talking about growth, how we want to try to time this with growth or before the major growth spurt happens. Have you ever been to your, obviously this is a question at 7, 8, might be more for the parent. The kid is probably listening. The kid may have no idea, right? What does your pediatrician say? Does your pediatrician say puberty is coming anytime soon? Any signs of that? The reason why we're asking, and you can put it in a form. I have that in my sleep disordered breathing form, some basic stuff, but it's more like, has the patient finished puberty? But just say we're trying to time, it gives us more of an idea of when we should be timing treatment. Obviously, if we're trying to do expansion or major growth modification at age 10 or 11 and this child finished puberty at 8, it's probably not going to work very well. And now you're looking more at jaw surgery. So it's really important that you try not to be embarrassed about this conversation and just to have it. And don't assume just because it's a boy at age 9 that boy is a little more obvious, right? Because obviously they grow super tall, and when they're done, you're going to see obviously facial hair. You're going to see a Adam's apple. You're going to hear a low voice. It's quite obvious when a boy goes through puberty, but it's more discreet in a girl, especially if they're wearing baggy clothes or, not everyone's tall, right? So good just to have that conversation and just to learn to feel comfortable with that conversation. And sometimes the kids will get embarrassed, but as long as you explain why, why it's important to you, then, usually it goes well. But a lot of times if you just put it on a form, I'm the same way. If I get something on a form and it seems really irrelevant, I'm like, well, I'm just not going to answer that truthfully because why does this dentist want to know about my child's puberty, right? They have no idea. So that's why you need to explain the why behind it, because we want to get everything right. But anyways, treatment timing has a lot of different variables is what it comes down to. I tend to be a little more aggressive on girls and less aggressive on boys, but ultimately it depends on if there's trauma being done, if the child's being teased, if there's psychosocial factors. So if the parents seem pretty jazzed up about phase 1, then, I want to know why, are you just excited because you just want braces on your teeth? Are you excited because you're concerned about certain things? Is there something I need to know? Sometimes kids get teased for having their teeth a certain way. Is this happening? Certainly I remember in grade school, there were plenty of kids who had some pretty wonky teeth that got crazy teased at 8 or 9, and that affects your academic performance, your self-esteem, and that is a reason to get started earlier. Definitely is. Sometimes there's phase oneers that, you know, are maybe heavily, I had this more in California than maybe I have where I live now, but heavily into acting, modeling. And I can tell you, you know, having worked with agents before that, yeah, if a child has messed up teeth, they're not going to get gigs. And it does make a difference, you know, removables versus fixed, Invisalign versus braces, they get a lot more work with fixed appliances than they do with removables. So it's just something that you'd want to know about. And I've had patients come to me because their agents recommended that they get their teeth fixed or, you know, younger so they can book more work. So just things to think about. All right, thanks so much.